to your right. Look at her. Look at the amniotic gland. I should take a look. See how white and crisp she looks. Look straight ahead. See that? Cornea is completely clear, no scar, pterygium completely gone, beautiful amniotic graft sitting with sparkling white eyes. Now, as I always teach, the biggest accountability is the patient on camera. That's what I teach. Remember my Gulanism. So no matter how good I think we've done, patient must explain. So patient, so now for 3 decades we have our culture here, our protocol that day one post-op we let pterygium patients, no matter how complex they are, walk up to the mirror and explain whatever. So please go. You just took off your, there we go.
It's definitely white, and now I'm wondering, how are we going to deal with the other tissue? Because this was the focus that I was trying to avoid everyone seeing.
Now you see how horrible the others are.
It's beautiful.
Yes, Chanel.
It's beautiful. So I could have a little, not be so self-conscious to hang around my friends. I'd go to dinner at night and wear like these see-through glasses, and everyone's like, "Why are you wearing glasses?" So this gives me a little bit of confidence, and you can ask my husband. I'm very No, I'm self-conscious, but when it comes to picking doctors, I take a lot of time.
Sure.
And that's why it took me about 5 years.
Yes.
Because I didn't want just to go to anyone. So I said, "Oh, this came across you." And I went through everything with a fine-tooth comb. The first day I came with my papers, my questions.
Yes.
And I said, "I think this is the guy." And in fact, you are the guy, and thank you. Oh my goodness. Look at that, okay.
Oh my God, you're in trouble. Well, safe travel back. Been a pleasure.
Okay, where are you going? You coming with us?
Aisha, but you see that? This is what I want you to be addicted to. The patient outcomes, their reactions, but that teaches you to become better and better. None of this you can guarantee, but guarantee a fight for them. She doesn't even know what I went through yesterday. Terrible scars, horrible pterygium, get the cornea clear, everything, but everything that she wants, can we give her more? Any pain?
No.
Amazing. All that dissection, no pain. So elegance, artistry, that's why I call these plastique techniques, QUE. Chanel, a real pleasure.
How far?
Pretty deep, about 10 millimeters inside.
Okay.
That's why I call this the iceberg concept. You're just seeing the tip of the iceberg. Especially where you come from the Virgin Islands, this is quite rampant.
Right.
A lot of people have done
And there's only one ophthalmologist that I know of, Dr. Bisco on that island, and from the other neighboring Caribbean islands, they come up to him, and he has kind of archaic procedures. When I first went to him, so I said, there's got to be an alternative. It has the suture process, and anyway.
No. Excellent. Look at her.
Come on, Gulani. What's wrong with you? Let's go.
Only my patients. I'll have a safe flight back. I'm very, very happy. Chanel. Excellent.
Hi, my name is Chanel. I'm from the Virgin Islands. That's in the Caribbean. And the procedure that I had with Dr. Gulani was a removal of a pterygium in this eye, the right eye. It's a bit swollen, but on the inner part here, it was super red, and it's really white and bright now, and I really can see the difference immediately. So I anticipate after the swelling will go down a bit, it'll be a little bit more noticeable and pronounced. I discovered Gulani on YouTube. He has a plethora of videos on YouTube. I was very surprised. A lot of the other ophthalmologists, I couldn't find any content, even on their websites, any videos. I went to 2 different ophthalmologists prior to coming to Gulani. One of them had suggested to do the procedure with stitches, using my own conjunctival tissue. Probably would have had to have removed it from my left eye, so that didn't sound like the best alternative. And then the other doctor, she didn't seem too interested in really addressing it right away. Gave me some steroid drops. So I'm very happy that I traveled to come to see Gulani. The whole facility is lovely. It's very it's clean, it's orderly, it's well organized. The staff is amazing and very kind, and I had a good experience with him. And I could tell he genuinely cares for his patients, and I hope to have other procedures in the future and continue my working relationship with him and the staff. And while I was here, I got to meet and converse with a lot of other patients from all around the world. It was kind of cool to meet someone that had the same condition that I had, same procedure. Hers was even more so complicated than mine, so it was good to connect with all these people and see that I'm not alone in this process. And yeah, it's a family environment, and I recommend anybody that wants expertise, a knowledgeable doctor, and a friendly environment to come to Gulani's Institute and the staff. And thank you.